Today we're going to focus on sterile technique. Sterile technique is an extremely important aspect of nursing care because in almost every skill that you perform, some or all aspects of sterile technique will be included in that. So it's really important and crucial that you understand the concepts and the techniques that deal with sterile technique. Again, it's the basis for all the other skills that you are going to learn throughout your nursing career. So, before we get started, a couple of things, a couple of terms that you may hear when you're talking about sterile technique. Sterile technique is another term for surgical asepsis, which means that all microorganisms are destroyed or absent. Example would be a sterile dressing change, catheter insertion, trach care. All of those are sterile procedures and they must have sterile technique incorporated into them. Another term that is similar but different is medical asepsis, which is just a clean technique, which means it's a method that inhibits the growth of microorganisms. A couple of examples would be hand washing, changing linen. So those are a couple of examples of clean technique. So today we're focusing on sterile technique. And what we're going to be doing today is just setting up a sterile field. So in your handbook, in your lab manual, you actually have a couple of skills. The one that I will be focusing on is going to be the check-off procedure for sterile technique. That is the one that I will demonstrate today and that you will actually do in lab for your check-off. However, it does incorporate two other skills in there. It is performing open sterile gloving as well as preparing a sterile field. So those will be incorporated into our check-off procedure. So we're going to say that Dr. X wants us to set up a sterile field for a procedure that he's going to perform. So the very first thing that we're going to do is we're going to get our equipment and we're going to make sure that our table is where we need it to be. One of the principles of sterile technique is that if you cannot see the sterile field or if it's below your waist, then it's considered to be questionable, and anything questionable is considered contaminated. So we want to make sure that our table is good height, so it's going to be at our waist. So I'm going to raise the height. So again, anytime you're doing a procedure, take the time to get your table where you need it to be. Make sure that your garbage can is within reach. Just take a few minutes to get everything where you need it to be. Try not to be in such a rush when you're trying to get all of this prepared. So, my table's at my waist, so everything will be above my waist. I'm going to be able to see my sterile field. In just a second, when I'm getting all the supplies out, you'll see how I move around the table so that at all times I'm keeping my equipment in my sight. My garbage can is to the side of me. Again, I don't have to walk away from my sterile field to make sure that everything is going to be within my sight. So, I've got all that set up. Again, make sure that I've washed my hands. Just because we're going to be wearing sterile gloves does not mean we're not going to wash our hands before, and then also make sure we wash our hands after we remove our gloves. The next thing that we're going to do is we're going to take our sterile tray and we're going to open it. When you open a tray or a package, you always open away from you first. Then if it had more of a package, then you're going to open the sides, and then you're going to open the side that's closest to you. So I'm going to open it away from me. Again, being careful not to contaminate. So again, just kind of slow, and as you see, my hand is moving backwards. It's not going to cross over anything that is inside this container because everything in this container is considered to be sterile. So as I'm going, my hand is moving away and not crossing over my sterile field. So I'm going to pull that back. The next thing that I'm going to do, if you look inside my package, you'll see that I have a package of sterile gloves. Now, again, depending on what skill you're doing or what you're setting up, you may have to have a set of sterile gloves that are outside of the tray. So here they are on top, so I'm just going to grab them, lift them out, set my tray back down. Then I'm going to come to the side. When you're opening your package of gloves, be careful not to let it fall on anything that is sterile. Remember that in order to maintain its sterileness, it can only touch other things that it's sterile. If it touches anything that we are not sure of or that we know that's contaminated, then we have to consider that item contaminated as well. So, I'm going to move to the side. I'm going to open my package. And again, the outside of the package is not considered sterile. The only part is going to be the inside where the gloves are located. Sometimes with the equipment that you're going to use in school for checkoff, you just have to work with it a little bit because it's been in there for quite some time. So I'm going to open it, and it tells me here at the package it says cuff end. So I'm going to put that facing me. So I'm going to open it up. It says right and left. So next I'm going to grab the tabs at the sides, and again, just very gently pull that open and kind of straighten it. Sometimes it wants to fold back in, but if you'll straighten it, it holds the gloves kind of in place. Alright, so the next thing that I'm going to do is now I'm going to put on my sterile gloves. You want to glove your dominant hand first. So you're going to pick up, for me, I'm going to pick up my right glove. So I'm going to pick it up by the cuff because that part is turned in so that I can touch the inside of the glove, which is not considered to be sterile. Next, I'm going to place my hands gently, and you'll see that when I pick up the glove, one thing that I typically do is I kind of step back away from my table so that I make sure I don't hit this sterile glove on anything, and hold it up. You don't want to hold it down where it could drag the table. So I kind of hold it up, slide my hand in, pull, again, just kind of nice and slow, working your fingers in there, okay. Next, I'm going to take my sterile hand, my gloved hand, and now I'm going to get my other one. So this time, I'm going to go inside the cuff. And again, pull it up. I'll take a step back. Go ahead and put my hand in here. Then I pull my thumb back so that I make sure I don't hit anything that is sterile. Now, this is something that happens quite frequently, is that, and it can even happen with the other hand, is that you get the glove on, but you don't get all the fingers in the right spot. That's okay. This hand is sterile, this hand is sterile. So now I'm just going to take a little time to get all of my fingers in the right grooves. Then I just kind of pull right here, right at my palm, and pull it down. Don't worry about this underneath here. That part's not going to be touching anything that's sterile, and sometimes when we try to correct that, we end up contaminating our gloves. As soon as I get my sterile gloves on, one of the very first things that I do is I go ahead and clasp them together, okay? So, we're going to get rid of our package, and you can either just kind of lightly use your elbow to just slide it off the table. If you've got your garbage can right there, then you could go ahead and get that done. The next thing that we're going to do is we're going to set up our sterile field. So, I have my box of my sterile equipment over there to the side. So again, your feet are not set in concrete. You want to move around the table, again, so that you're not contaminating any part of your sterile field. So I'm going to move around here to the side. I'm going to grab my drape, pull it up, out. Then when you're using your sterile drape, you just kind of let it fall out. And again, hold it up and away so that it's not touching your table. Grasp the sides, then gently let the far side fall, and then let the near side fall. Be careful trying to place it on your table, because again, when you try to place it, you may come in contact with the table itself with your sterile gloves, and then they would become contaminated. So, we've got our sterile field out. Next thing I'm going to do is I'm going to get the supplies out of my box. So again, I'm going to walk around. The only thing that can touch sterile is sterile. So be careful not to cross from here to here, which is not sterile. So again, I can pick this up, step back, move over, and with your sterile drape, 1 inch around the perimeter of your drape is considered to be contaminated. So we're going to place all the supplies within that inch of the perimeter of the sterile field. Then I'm going to place them down. And you can separate them out if you need to, depending on what your physician is doing. If you wanted to place all of the gauze. And again, you see how I move around the table. Also in my box, I have some pipe cleaners. So again, I'm going to go around, grab that without crossing over my sterile field. If I needed to, I could even go in front of that to place those, or again, back over here. Again, my field is staying within sight at all times. Place rest of my equipment down, okay? So, one of the instructors, when you're checking off, may say, I want this cotton twill tab moved from where it is now to the top left corner, according to where I'm standing. So again, we can't pick it up and just move it, because then we would be crossing that sterile field. So what I'm going to be doing is I'm going to pick it up, and again, I can either go to my right or to my left, go over, and place that here without crossing my sterile field. So the main concept is you can move around your table. That's why it's so important to get that table out away from everything else and where you need it to be so that you don't have to worry with it. So we have our sterile field set up. So the next thing that we're going to do is we are going to go ahead and take off her gloves. When you're taking off gloves, remember that you grab it by the palm, pull it inside out as you are wadding it up into your other hand. Then you're going to slide 2 fingers into the other glove, pull down and away from you, pulling everything inside out, okay? And then we can place them in the garbage can. The next thing that we need to do is go ahead and pour our sterile solutions into our tray. If you look at our tray, it has 3 compartments. So we want liquid in all 3 compartments. So the very first thing that we're going to do is we're going to pick up our solution. We're going to make sure that it is the prescribed solution, and also that the expiration date has not passed. We're going to make sure that there's no particles, anything in here that shouldn't be. So I see that this is normal saline. The expiration date's June the 1st of 2016, so we're still in good compliance with that. The next thing that we're going to do is we're going to take off the cap. When you take it off, you want to put the cap on the table with the flat side against the table. Then we are going to grab the bottle, and when we grab it, the label needs to be in the palm of our hand. This goes for any liquid that you ever pour, whether it's a medication or a solution. The reason being is when you hold that label in your hand, that prevents liquids from running down into that label where you can't read it. Anytime you can't read a label, then you don't need to use it because you're not for sure what's in that container. So you're holding the label against the palm of your hand, so it's facing the palm of your hand. The next thing that we're going to do is we're going to clear the lip of the bottle. This is called lipping. The purpose of lipping is just to clear that area. So again, I have my garbage can here. We're just going to pour just enough to lip that bottle. Okay, so that is the area that I lipped, which means that when I go back to pour, that is the area I need to pour from. So again, I want it into all 3. Now again, the outside of this bottle is not sterile. So if I wanted into each container, pour. And again, you want to avoid splashing. Another principle of Sterile Technique is that if something sterile becomes wet, then we have to discard that because it's considered contaminated. I'm going to pour into our next one. And then thirdly, because I can't go over my sterile field because the bottle is contaminated, again, I'm going to move to the side, pour it that way. Once I get done, I want to make sure that I put the cap on the bottle as soon as possible. The longer that a sterile solution is exposed to air, the more it can be contaminated. So after I get all my solutions poured, I'm going to put the cap back on, snug, and then I'm ready for my physician to come into the room. Also want to make sure, since I removed my gloves, go ahead and wash my hands and get prepared to assist the physician in any other way. Now, sometimes with other skills, you may have to pour first. You may have to have one sterile hand and non-sterile hand, and we will talk about that as we go through. But for today, what we're focusing on is just your checkoff for that sterile procedure, which is exactly how I've done it here. And then later on, we'll learn how we can modify that to fit whatever skill we're doing.